Hello, South Africa. Welcome back to Coronacast. It's Tuesday afternoon at 2 o'clock, and we look forward to another action-packed episode. Well, today's the 33rd episode of Coronacast. We're on day 103 of the government's lockdown. And I've got some news for everybody. This is the second to last episode of Coronacast. Unfortunately, all good things must come to an end. But the good news is that we'll be restarting up with a new package based on my weekly newsletter called Straight Talk. We will be unpacking issues that matter the most to you at home as South Africans. We'll be talking about the virus, we'll be talking about the initiatives of DA governments, and we'll be tackling some hard and thorny topics that South Africa needs to engage on going forward. So please stay tuned on our Facebook, on our Twitter platforms, and keep up to date with the latest information about the newly packaged show that's going to be coming your way. And we promise you it's going to be cutting edge, it's going to be exciting, and it's going to be relevant to the things that matter to us as South Africans and our future as we progress at this particular time. But before we continue today's show, I do want to express a little bit of concern about a document which was leaked to the Democratic Alliance over this last week, and it was broken in the media by one of our members on the Cooperative Governance and Traditional Affairs Portfolio Committee, Siviwe Gwarube. The document essentially packs out how government is going to use this crisis to repackage the way in which the macro governance is done in South Africa, with setting up a national coronavirus command council type style of government across the entire country. This is obviously very concerning. We've already seen how the National Coronavirus Command Council has been able to operate without oversight in an undemocratic way, and many of the ridiculous, bizarre, frankly absurd regulations have come out of that National Coronavirus Command Council. The last thing we need in South Africa is that model being rolled out across the country. It will spell doom for the survival of democratic and accountable governments. But obviously it's very tempting for a government with authoritarian tendencies to want to move to this type of model, because you're able to do what you like without a pesky parliament in your way. You're allowed to change the law without consulting the elected lawmakers of the country. We need to make sure as citizens that we stay vigilant and that we make sure that we resist this type of takeover using the guise of the pandemic to extend the tentacles of an authoritarian state across South Africa. We need to keep the flame of democracy, of liberty, and of freedom burning in South Africa. The only way we can do that is by you helping us to keep vigilant and to speak up against this authoritarian grab of power. We'll be talking a little bit later this week around a little bit more about this and unpacking it. So do stay tuned on the various platforms, because it's a document that all South Africans need to know about. But today's show, we're going to be discussing the whole issue of readiness, a hospital readiness, as we've seen the numbers of the virus starting to spike in places like Gauteng, the Eastern Cape, and KwaZulu-Natal. And we're going to be discussing what was the hard lockdown used for. Did it achieve everything it needed to do? Why, after one of the hardest and longest lockdowns of the world, are we still seeing hospitals being overrun, a lack of oxygen tanks? These are the sort of things that should have been prepared for during this crisis. And so for today's show, we've got a health focus completely. I've got Professor Alex van der Heever from the Wits School of Governance, and he's written some terrific articles, News24 and other places. If you haven't read Professor van der Heever's stuff, please do Google it. It is really worth reading and really worth listening to. He knows his stuff. Then I've got Zahid Badroodien, who's the Dr Zahid Badroodien, who's the MACO member for health in the city of Cape Town, and we're going to be talking a bit about the health response. And then, of course, no stranger to Coronacast. She was around right, I think, from the second episode, Siviwe Gwarube, the DA Shadow Minister of Health, who has just returned from being on the ground in the Eastern Cape. And we're going to be talking a little bit about what she discovered there. So stay tuned. It's going to be very, very interesting. But I'm now going to go to Professor Alex van der Heever. And Alex, welcome back to Coronacast. Thank you very much for making your very valuable and very precious time available to us. I know you've got some time constraints, so let's jump straight into it. You recently penned an article which was published on News 24. Every home should have a copy of it, about how government has wasted and squandered the resources. Do you want to take us through the gist of the research and the basis of your argument as made out in that article?
So dealing with the COVID pandemic requires that you prepare your health system in two ways. One is your prevention framework, and the other are your treatment platforms. And now the problem with this kind of epidemic, and as we've seen in other countries and have been forewarned, is that we will be overwhelmed no matter how we prepare our health services. So prevention is really the key intervention. And a lockdown is not going to be, we can't implement it for very long. And it's not possible in the South African context, which means that to the extent that any lockdown is used, any generalized lockdown, it could only be to deal with an initial period of inadequate readiness because of the shock of the pandemic itself. So it should only ever be limited. So the intervention would have been testing and tracing at scale. And I've repeated this. This is internationally what you do. You separate the infected from the uninfected, and you suppress the epidemic to a level at which you can manage it. So testing and tracing only works if the number of new cases is relatively low. If the cases get too high, then effectively you have to fall back on using the testing strategy more defensively. So you really want to be in a position to attack the epidemic. In terms of contact tracing, we also need highly efficient contact tracing platforms. And within government, we were meant to have set up some sort of structure at the CSIR. And I'm really concerned about this because I'm not sure that any province is really even drawing on that platform, and I'm not actually sure what it's for. But if you go to the most countries that have effectively attacked the epidemic, they will have an electronic contact tracing platform, which will have a high degree of immediacy in its response. It's unclear. We have no app, we have no electronic system, and the CSR platform is sort of clouded in secrecy. And yet we basically have a private sector in South Africa with many organizations who could have developed such a platform and cooperated in a transparent framework with government, and we would have been able to contact trace very efficiently. So these two key aspects of the of a prevention strategy were effectively not invested in. And I want to just point out one thing on the testing. We're now testing in excess of 30,000 a day, but most of that still is in the private sector. And the private sector is not testing as part of a unified strategy. So the private sector somehow has managed to exceed the public sector in terms of the number of tests and to grow the number of tests they're doing. Public sector, the NHLS has indicated that they are unable to access testing kits, etc., because of supply chain constraints, lockdowns internationally, and countries all buying up the stuff. But for some reason, the private sector has managed to expand despite those accessing the same supply chains. So it looks like it's just an excuse. So the problem there is that we should have developed a unified strategy around testing, which incorporated the public and the private sector, and also brought in the university laboratories. That was not done. Our entire preventive testing framework was set up in one organization, and all our eggs were in one basket. So those are very key aspects. That part of that arm of our prevention framework has not been implemented, which makes it quite difficult to attack hotspots and to effectively keep them suppressed where you see it taking hold.
Alex, you speak about the three-pronged approach, and you talk about that in the article, to managing the pandemic in South Africa. What does this entail?
So we have, there's several articles that a few of us have also put out. And one is understanding the risks associated with transmission and making sure that how we're addressing those from a strategic perspective are in place. but it's also about how people are advised to protect themselves. So there are three aspects that are quite important. We call in the one article the sort of distance, dose, and dispersion, the sort of 3 Ds. And these are not in government communication at present. So the distance is, everybody knows, if you keep a certain distance away from people is quite important, the social distancing. Dosage is very important because to become infected, you require a relatively high dose, a minimum dose to impact on you. So the longer you are in the presence of somebody who's potentially COVID positive, the higher the risk of being infected. So the issue of managing the risk of receiving that dose is important. Dispersion deals with the issue of the fact that, and it's becoming much more public, the idea that the virus itself is airborne. And this is not droplets, it's airborne because it's aerosolized. And that means that the virus is hanging in air in any space for a very long period of time. It will stay there in an enclosed space. So ventilation becomes really important. So the room you're sitting in at this moment, I would actually regard as relatively high risk, depending on how long you're sitting there. And even if you're wearing a mask, you're potentially exposed to risk. And this is why a lot of our frontline workers are potentially being infected, despite the fact they're wearing full PPE. Toilets, enclosed spaces in restaurants, air conditioners that recirculate air within them. So the places that are exposed to open air are important. So our messaging on that from a prevention perspective is taxis should have their windows down. It's as simple as that. They don't have to have them fully down, but they have to have them sufficient so that you're blowing the air across. So the 3 Ds we've got here interact. So you want to be keep a distance. You don't want to be in contact with anybody that could be positive for very long. So you keep your time low, and you make sure that you're in a space where the air is being dispersed. And I think that what we're seeing now is super spreading events in a lot of environments where the airborne aspects of the virus are not being managed. And that's a key aspect of risk, which is managing the risk, which is distinct from testing and tracing as a strategy. We've got to protect the social spaces that where we are exposed to the environment. And when we've opened up the economy, which we can't afford not to do, we have to make sure that those social spaces are protected, particularly for the airborne aspects of the virus.
Alex, there's a big move to keep public parks and national parks and that closed and beaches closed. Does that make sense to you? Is it worthwhile? Is the virus very transmittable on a beach, in a big public park, or in a game area?
Wherever the air is being dispersed, so outside is going to be considerably safer than inside. So potentially one of the reasons why the flu, influenza, all these sort of respiratory diseases tend to do very well in winter is not necessarily because the virus survives very long in the cold. It's because you go into enclosed spaces, okay. and there's very poor ventilation. Mm-hmm. So the outside is definitely safer. So even a restaurant that's outside, provided there you socially distance, you take note of the fact that you want to be away, not too close to anybody, that if they're not living with you. Mm. And but outside is going to be completely different to the risk indoors. And just to note that a lot of companies and a lot of restaurants and theatres and stuff, we don't know what the nature of their air conditioning system is. So one place might have an air conditioning system that isn't recirculating the air and therefore is a lot safer than a place that is. So in fact, a lot of our messaging and our health protocols in these spaces are not up to date. And in fact, we're going to be washing down spaces, cleaning them up, but we're not worrying about the air. And that is a problem. We're sending people back again and again into environments where the virus will reaccumulate.
Yeah. Alex, what would you say has been the biggest failure of government to date, if you could pinpoint that down?
So to me, it was absolutely critical that we put in our prevention infrastructure. That was really what we had to get right in 3 months. And really by the end of April, we should have had our testing and tracing infrastructure completely in place. We also should have had the messaging, this type of stuff that I'm talking about, in place. Our health protocols, because during that period, we have to prepare for opening. So when you open, you want to make sure that you're not going to suddenly create a rocketing epidemic. So, and we have no choice but to open. It's not like we have a choice there. So by the sort of end of April, we should have had all health protocols understood exactly where the risk areas are. We don't have those. There are no taxis, for instance, now that are required to drive with windows down. The bus system is all enclosed spaces. So every time somebody gets into a taxi, it's a roll of the dice at the moment. So those are all places for super spreading and reseeding communities where the virus had been eliminated. So I think that really is the key failure. On the services side, there's a massive failure on that side. In the Western Cape, the field hospitals that were set up are real hospital beds with oxygen fed to them. The Nasrec beds are furniture beds bought from furniture shops. They're not really hospital beds, and there's no staff with them, and there's no oxygen supply to those beds. So in Gauteng, we've got a problem in that supposedly we prepared for a contingency risk, a contingency in which we may need to use those beds, but they are not prepared. And right now, the hospitals are being overwhelmed. Eastern Cape is already beyond the point of being overwhelmed. And there's been effectively no preparation for prevention or treatment in the Eastern Cape. So I think and they were already a health service in a dire state prior to COVID epidemic. And this is just revealing just how bad it is.
Mm. Alex, the last time we spoke, and you were very kind to give us time previously, you were struggling to get data from government. Have you been able to get the data that underlined their COVID response and that built their response around, or is that still being kept from us?
Yeah, so the data, and I've published articles on having data made public, and I'm not going to sign an NDA to access data. That's the more granular information. There is information that's in the public domain that still provides some sort of useful indication of what's going on, and then snapshots of risk at a more granular level, but it really doesn't help you if you don't have the trends. So on the one hand, I think that the granular data is still not being made available to the public, and there's no real rational reason for that. And it's not necessarily even being made to all government institutions. So there's no rational reason for the way in which information is being disseminated at this point. And it would be very good if 30 different academics, none of them contracted by government, were independently looking at data and reaching their own conclusions and being part of the general debate. We don't quite have that. In terms of the modeling information, some of it has been made available and the key assumptions. I've looked at those, and I think that my key point would be that there's been this narrative that is put out that somehow we're expecting this surge. I think it needs to be made very clear. No model can tell you and predict a surge. These models are crude forecasting models, and they can't take into account the prevention strategies that are implemented. And the trajectories that we see are not predicted trajectories. They are all contaminated by interventions. And if we don't intervene, then the epidemic is going to follow some version of a model projection. Yeah. But it's important to note that the model projections have no basis to peak and turn into a negative trajectory other than a prevention strategy. Because in all environments in the world, the epidemics peak only because of interventions. They never reach herd immunity. But the models can't do anything but turn on herd immunity. And this is where it's completely artificial, because they will always over-predict the peak. And all we can be doing is trying to judge and measure the effectiveness of our interventions against the trajectories we're seeing. And if we start to see the trajectories turning down, it's because the interventions are working. And if they're not turning down, our interventions are not working. And so in the Western Cape, you see that the trajectory has completely changed. And there's a check, because the testing strategy changed. So you can't be sure that what you're seeing is a change in the testing strategy. So you have to look at the mortality information and the inpatient data. And the mortality information is backing up the new case data. In Gauteng, the mortality data is now starting to reflect the very, very steep rise that we've seen recently, which is really very frightening because it suggests that they're not in control.
Alex, if you could have one piece of advice that you'd be able to give to the premiers of the Eastern Cape and Gauteng, what would it be? What is the one piece of advice you would give them now, given where they sit?
Sure. I mean, an epidemic is very much an emergency intervention. And where you've got pre-existing systems that are relatively fragile or weak and are not going to respond very well, it does make sense to verticalize. And that means creating certain platforms that are going to basically deal with all the cracks in the system centrally, because in an epidemic, you can be fairly narrow about certain interventions, like testing, tracing, which means that I would say that you need an operational platform which combines the best expertise in an area around a particular issue. It does not need to be secret. Nothing needs to be secret in this epidemic, nothing. It should be all open. It can be in the middle of continuous streaming live television, and that would be appropriate. What you need is to get the best public and private sector expertise, and the private sector is willing to provide that expertise for nothing in many of these cases. But you need that strong platform, and you need to be pretty agile in how you switch to where the next emergency is until you've got control. And I would say that the prevention strategies need that kind of expedited high quality platform, and it needs to bypass the platforms that are failing. So just sending in crude teams is not sufficient. You actually have to set out structures, but it's unlikely that type of proposal will be followed.
Mm-hmm. Well, Alex, thanks. I know you've got to rush. You are in huge demand and you've got other interviews. Thanks for making time for Coronacast and for all our viewers there today. I'm sure we'll speak to you again on the Straight Talk platform, where we can, talk a bit more straight about some of these things like data and the like. But thank you very, very much, Alex. It's always great to have you on the show.
Thank you.
Oh, thanks. Well, before I move on to Zahid and Siviwe, I'm sure you found that very interesting as well, and we're going to unpack a little bit more about that. Particular stuff around transparency. And Zahid, I think that's important that we chat. I want to talk a little bit about the statement released earlier this week by Alan Winde, the Premier of the Western Cape. And as you know, Alan was on the show with us last week on Friday. And I'm proud to say that they've got a number of achievements that are racked up under the provincial government in terms of dealing with many of the things that Alex has outlined. So, for instance, the Hospital of Hope at the Cape Town International Convention Centre and the partnership with Médecins Sans Frontières and the Tucson Hospital in Khayelitsha have provided nearly 1,000 additional beds in the metro. Since the 1st of June, the Hospital of Hope has provided care to over 600 patients, with over 300 of them discharged by the 30th of June. The construction at the Brackengate facility, which is going to create a further 330 beds, is complete, and the final fitting of beds and equipment is underway. And then the hospital is looking to take in its first patients on the 10th of July. And then, of course, the first 63 beds of the 150-bed Sonstraal facility in Paarl is coming online in July. In the province, Alex has spoken about testing and the importance of testing, tracing and tracking. Over 316,000 people have been tested for COVID-19 in the province. The quarantine and isolation, speaking about being able to keep the distance from people who are infected, the Western Cape has brought 41 public and privately owned quarantine and isolation facilities online with a total of 4,766 beds. And there's a few more sites that have been identified. There's triage centres, obviously very important that people have a facility to go to when they suspect they've got COVID or whether they start to present with symptoms. And there are 19 temporary testing and triage facilities that have been set up. And oxygen, this is a big thing, and Siviwe was going to talk a little bit about the oxygen crisis in the Eastern Cape a bit later. But the Western Cape has supplemented the high-flow nasal oxygen in the Tygerberg and Grooterskuur hospitals with a total of 121 machines acquired for this, with 43 more on order. And of course, there's been over 400 temporary healthcare workers to help meet the increased demand in the province. And there's been a network created of over 2,000 volunteers. And this is very significant going forward. So Siviwe, welcome back to Coronacast and welcome back from the Eastern Cape. Now, you've just returned from your trip there. Do you want to talk to us a little bit what you saw there, what oversight you did, and where some of those key problems are existing?
Yeah, so I visited Buffalo City Municipality Cecilia Makiwane Hospital as one of the hotspots, and Fort England Mental Health Hospital in Grahamstown, which is a tertiary mental health hospital in the province, because they've had a number of outbreaks there, which obviously, because it's a psychiatry hospital, creates a certain set of challenges for them. But I think following on what Alex has said, this is why this is the reason why we have called on for the Eastern Cape to be placed under administration, because it's in a situation where the health system is so weak, the leadership both at a political level and at an administrative level is almost completely incapacitated. It doesn't matter if you were to pump resources into that province or give extra boots on the ground or extra equipment. If you don't have competent operational leadership, it's almost impossible to utilize. It's going to go to waste. And so that is why, we've seen the military health being allocated to the Eastern Cape, and that is fine. But the reality is that both the Premier and the MEC have both admitted that the province has lost the battle against this pandemic. We have seen cluster outbreaks. They've had poor testing strategy and almost non-existent tracing strategies. We have seen the health system, they're completely overwhelmed with people fighting each other for oxygen. Something as simple and as basic as getting oxygen supply, not even ventilators, just merely oxygen supply. We have seen a situation where the certain hospitals, like regional hospitals like Cecilia Makiwane, only have 2 ICU beds, and they are still yet to bring more on board. The entire Buffalo City area has no field hospital whatsoever. And so the province is completely ill-prepared.
So it's almost like they've taken everything that Alex has spoken about and done precisely the opposite.
Absolutely, absolutely. And so the only way to save lives in this instance is almost to create a parallel system, and you have an operational leadership that can utilize the good parts that exist in that system. But to try and fix something that has been broken over 26 years in 3 weeks is not going to help when the death numbers are rising on a daily basis.
Yeah. Now, Zahid, you're a medical doctor. You've listened to what Alex had to say. Do you share a lot of the concerns? And I'm sure that's a lot of what's informed the city strategy as well.
Absolutely. I think the most important thing that has come out of what we've learned as a result of COVID is about being prepared, not being in denial that COVID is coming and that there are various models that are predicting either very high or very low numbers or somewhere in between, but regardless, to make sure that the capacity that you have, whether it's in the city, whether it's in the province, is able to cope with the amount of patients that may need to go into field hospitals or into your tertiary institutions, or even with those who can just remain at home in terms of isolation, specifically when you're waiting for results. And so these are all parts of a puzzle that the province has identified very, very early on. I remember very early in March, when the virus had started to make its way into Africa, we were all expecting it to come, and it happened very rapidly when the first patients arrived in Durban. It came over to Cape Town very quickly, 2 days later. And so the mayor in that instant had activated the task team that would put together all the plans to make sure that we are ready. But the important part here, and I think what has been mentioned, is that none of your efforts to prepare can be done in isolation. You've got to work with partners, whether it's province, whether it's private, whether it's the local government, to make sure that you have access to all of your resources. It's not just good enough to think about the plan, but the implementation is also very key.
Yeah, absolutely. So Siviwe, are you concerned about what's going to happen in Gauteng, the Eastern Cape, coming soon to KwaZulu-Natal, no doubt, and many other provinces where I think
Yeah.
there's a massive underreporting of,
Yeah.
of cases.
Yeah.
What's your sort of synopsis, your overarching analysis, and what are your biggest concerns?
My biggest concern is that one, this pandemic found the South African health system already on its knees. And it required us to utilize the past 3 months to be able to plug the holes in where we've got gaping gaps in order for us to be able to at least mount a decent response to the pandemic. So that's what we needed to do, because if we understood properly the state of our health system before the pandemic came, then all that we needed to do is to plug the holes so that we can at least be able to cope. But we haven't managed to do that. And so that is the problem. So you get provinces, for instance, like the Northwest, that I've learned in the last 2 days, that have reported 29 deaths. When people wanted to find out why there was such a massive spike, the province said that they were still collating the data. Now, that completely undermines your ability to be responsive, your ability to be agile as a government, your ability to plug the holes, so to speak. So I am definitely concerned, and we're starting to see even the low provinces, the provinces that had the low numbers, the Northwest, the Northern Cape, again, with cluster outbreaks starting there. And as the economy opens up, because we haven't necessarily prepped the health system, we're going to find ourselves in a situation where we are unable to cope. So the Eastern Cape is a massive problem. Gauteng is experiencing massive rise in fatalities and also their numbers. And admittedly, also the health system is unable to cope with with what is needed, particularly with people with comorbidities. And you are finding that more and more of people are going to be need hospitals. And so it is very concerning, for instance, to find that massive institution that was unveiled a couple of days ago at Nasrec is only just normal beds. Because obviously, people who need to be isolated have different needs. So as we have here in the CTICC, we've got beds that have oxygen, because while you may not need acute sort of assistance from an ICU at a hospital, you do need oxygen, you do need staff. And those are some of the things, because again, also an ICU or high care setup is only just that. If it doesn't have the necessary staff, it can't function. And so I am concerned, and I'm concerned about the lethargy we're seeing in the provincial departments. The fact that the president came out and said money is not a problem, but money is a problem. Provinces have not received the equitable share of the money that was said to be allocated to provinces. Now you have a situation where people can't appoint extra staff members. As staff members are getting off and being sick, ICUs are left unattended. So this is a massive crisis.
So, Siviwe, this is very worrying, because we had one of the hardest and longest lockdowns in the world, and yet it appears that time was completely wasted, and that when oxygen should have been procured, when staff should have been taken on, that wasn't done. And now we've got this Potemkin village at Nasrec, potentially, and this is a big concern. So where do you think the failure lies? Is it the incapable state? Is it where would you say the biggest challenges are?
I think we have completely had no proper political and administrative leadership at the various provinces. I think that the vision might have been there, but when it came down to implementation, and that's what we as a DA had said right at the beginning, that we're lending our support to the South African government every step of the way, because we want to save lives. But we knew, and we said, and we warned that the test here is going to be in the implementation, and that's where people have been let down yet again, because we've got people in positions who don't deserve to be there, who are incapable of occupying those positions, and who are incapable of leading institutions. Those institutions have been broken, they've been looted, and so they're literally empty shells. And so even if we had a really good strategy, when it came down to implementation, we were never going to be able to pull that off. And also it's very concerning because it seems as though the president said one thing and yet in practice what's happened is very, very different. So where it begs the question, when we look at what was tabled by the Minister of Treasury, none of that money that was said to be allocated to provinces is being allocated. The Western Cape has a shortfall of almost over 2 billion that they have to find somewhere because they were expecting money
Money's
to be
got to
allocated.
come from somewhere. Yeah, and this is the thing. So, I mean, you've called for the Eastern Cape to be placed under administration. You've told us why. What could be replicated from the Western Cape story to the rest of the country that are going through what the Western Cape you went through a few weeks ago, a month or so ago?
Look, I don't want to be defeatist and say that the province was always going to perform better because the health system was always in a better position, because obviously we now need to look forward. But it has a massive impact, obviously, when you've got operational political leadership already functioning and being able to deliver a service, as the Western Cape was able to do so. So without that, it is very, very difficult. And that's why my view is that, where time is now of the essence, because the field hospitals have not been bought, have not been secured. It almost seems that a unified national strategy needs to be brought together so that we can have a situation where private and public sector come together to try and direct some of these things very quickly. But then also, as Alex said, bring in expertise from various sectors and say, right, this is now crisis
Action
time.
stations.
And we've got to make sure that we've got, if the HOD in the Eastern Cape is not up to the task, let's put somebody who will be, so that we can make sure that systems are running very, very quickly in order for us to save lives.
Well, Siv, Dean van Dijk has written in to us, and thanks, Dean, for watching. And I know it's an issue that you've been taking up. We've spoken about it on several occasions. He says, if the Eastern Cape are having issues with funding for health and oxygen, why then did they spend 10 million on moped sidecar beds that have got corruption written all over them? You saw those beds. You saw the minister very proudly perched in one of them. You could break your neck on the way to the hospital, never mind COVID, on one of those.
And now 10 million has been spent on that tender, and those motorcycles are now sitting in some workshop in the Eastern Cape. And so, and to Dean's point, exactly, that the reality is that even if you were to pump resources into a province like the Eastern Cape, if you don't arrest the situation by almost sidelining the current leadership that's there, you are not going to yield the results that people desperately need. People are dying in places and in situations where they shouldn't be.
This actually is a really good example why administration is needed there, because even if national government was to pump in hundreds of millions of rand now to try and arrest the situation, the chances are it's going to be funneled into these sort of vanity corruption projects and opportunities.
Look at what happened. Look at what happened in that local municipality in the Eastern Cape. I think it was OR Tambo municipality, where 4 million rand was spent on a door-to-door awareness campaign. And I mean, I don't know what door-to-door campaigns the city can do for 4 million, but it just seems so absurd to me.
It was crazy, and John, this is the theatre, friends. At the very beginning, we identified where the shortfalls are, whether it's related to ICU beds, general care beds, intermediate care beds, or even just door-to-door / education necessities. We've covered that. We've got a very competent premier in the Western Cape who's assisted by the Minister Mbombo, but also very competent local government in the city of Cape Town. I can only speak for the city. Where we're able to support.
Very competent MMC as well.
Yes, I agree with you. And so we're able to support each other. I mentioned earlier that we've made our resorts available for quarantine and isolation so that these facilities are located in the communities where residents or patients can be accessed very easily in a safe way. But also we've closed these gaps. Yes, we recognize that there may be a shortfall in ICU beds, but the minister very early on went to the private hospitals and said, guys, we need to close this, we need to work together. What can we do to be able to ensure that we don't find ourselves in a crisis? And so that's how we've been able to stay ahead of really crisis in the Western Cape, which we're not in yet, and I don't expect us to ever be, because we're always going to be a few steps ahead of the
virus.
crisis.
And I think that's what Alex was talking about.
Yes.
So it's, you can be model obsessed,
Exactly.
or you can be intervention obsessed.
Exactly.
And I think that's what's been great about the Western Cape as response, which is why Alex said it, the Western Cape numbers are responding to the interventions
Exactly.
rather than us, being obsessed about
We
graphs.
mustn't be running after graphs. The
Yeah,
graphs
yeah.
need to be running after us.
After the
We always
interventions.
need to know that we're ahead of the curve. And this is what the President said. The President said that he's pleased about the work that we're doing in the Western Cape, the efforts that we're undertaking. He believes that we're well ahead of the preparations. And he also committed to money not being an issue. And Siviwe has now very clearly said that a month after his visit, we're still waiting to see a cent. Meanwhile, a day after his visit, Minister Mbombo, as well as the city, advertised the fact that there were thousands of doctor and nurse jobs, pharmacist jobs that are now available for people to apply for, so that we can close that gap. But national government hasn't followed us to support, and so the Western Cape, again, as always, is putting in more effort than any other province with very little support from national government.
Siv, where to now? What needs to happen?
Look, so tomorrow we've got the Minister of Health giving a ministerial statement in the House. It's going to be very important for us to actually, it's an important platform for him. We are now 104 days into the lockdown. South Africa had signed a social contract with the South African government that you will build capacity, we will stay at home. One of those parties has breached that contract. And so I think it's very important that the minister takes the nation into his confidence and states exactly what is going to happen now. It would be very important for him to use that platform to announce a number of things. One, funding to the provinces. That needs to be made very clear because provinces are looking for extra capacity. Secondly, how he's going to make sure that non-performance in the provinces is dealt with, because there are some provinces that aren't performing. And so we need to understand how that is going to be sorted out. And secondly, how the issue around testing, ICU beds, isolation facilities and field hospitals is going to be tackled as well. So that's what we are seeking to hear from him. But we will also be using the opportunity to table some solutions, as we have been speaking here today, that what are some of the things that we think should be done now, 100 days into this crisis, to be able to arrest the situation and save lives. Because, it doesn't help for us to say, we can point out that, 3 months has been wasted and we haven't built the capacity that we need. But because we are also focused on making sure that we save lives, we are now going to do the work of saying, government, this is what you can do to essentially save lives where lives will be lost unnecessarily.
Well, talking about preparation, I think we're going to show the viewers a short video about the hospital and the state facilities here in the Western Cape, and look at South Africa's biggest COVID-19 hospital. And then we're going to come back and have a chat to Zahid. So let's watch the video.
This facility is a facility that has been put in place by the provincial government. It is according to our curve and the need for extra beds in our system. We don't have sufficient beds in our hospitals, and we've had to build an extra 1,400 beds, of which 862 are right here in the convention centre. This hospital will draw patients from any of the metro hospitals or clinics at the moment. So to get here, you could come from any. You could come from Khayelitsha, you could come from Mitchell's Plain, you could come from Tygerberg. So you could come from any of those hospitals to end up here. They've had to treat the CTRCC as a hospital, and so you won't come into the CTRCC like you would normally come in for a conference or a jazz festival. You'll come in the back, so the sort of ambulance will bring you in. You'll come in through your triage and be brought into the hospital. The hospital now is going to be totally paperless, because obviously that paper and files also become a mechanism of transferring virus from one hospital to another, or one patient to another. And if we do need to put extra facilities in place, because we'll be looking at those numbers, then of course this gives us time to do that. But we might have to. If we see we need to, then obviously we'll then find another facility to do exactly the same as this.
Well, Zahid, I mean, you're a medical doctor, and I'm sure you've trained your whole training career. You never expected you to see something like this in your lifetime. But that's a really impressive facility.
Yeah.
That's a game changer, surely.
Absolutely. One of the very many impressive facilities in the city, let alone the province. And I think we saw very clearly our Premier inspecting the access to oxygen and the hospital beds. But these facilities are so important because we've recognized very early on that our hospital facilities are at capacity or will be at capacity as a result of COVID. And in the beginning, when the alcohol wasn't being sold, it was very easy to focus only on COVID-related ICU cases and access to those kinds of beds. And so now with the change in, I think, the situation with alcohol being sold again, communities filling up hospitals, sadly, in our Cape Flats areas with trauma cases, these kinds of facilities are now much needed because we're able to decant patients who are stable enough to go into an intermediate care facility. And the facility we saw now, the CTICC, has over 800 beds. The Brackengate facility will have just over 300 beds. And so in addition to our other facilities being the resorts and so on, we're well above the capacity that we're needing. But the interesting thing is, and I spoke to the Minister this morning about our quarantine and isolation facilities. We've got access to about 1,000 or 10,000 or so beds, but the uptake sadly hasn't been what we were wanting it to be.
So what's the message that's got to go out there to people around these facilities? What is the thing you want them to hear about?
So I want our residents to know, not only in the city, but where these other facilities are, whether related to quarantine and isolation facilities or the intermediate care facilities, that these are really quality standard buildings and infrastructure that has been put together by the Western Cape government. And residents mustn't feel as if they've got no access to quarantine and isolation facilities, because it's there. The services, whether they be in terms of food and the way you're looked after, is of a high standard. And so if you're finding it difficult to isolate at home, please, the Minister's also made some of those contact numbers available where it's as easy as making a telephone call to ask for access to these facilities. But the Western Cape again has gone above and beyond just making the quarantine isolation spaces available. We also now have the Red Dot taxi service, which the Premier spoke about when he visited you. And this is a service where you're able to pick up and drop individuals at quarantine and isolation facilities. And so we have this network of facilities, being isolation and quarantine, whether at home, whether at one of our facilities if you need access to that. But as we've seen also, the CTICC, Brackengate, Sonstraal, and other facilities where they're really helping us to relieve pressure off the facilities so that the doctors who need access to ventilators or high flow oxygen can do so very comfortably and very safely in the hospitals where these facilities exist.
The City of Cape Town signed a memorandum of understanding. You guys have made 20 million rand, I believe, available for community social relief to victims of gender-based violence and homelessness during this period. Do you want to just take us through that?
Absolutely. In the city, we recognize that there are hotspots, very clearly defined by the Minister's definition, 5 per 100,000 active cases. But we've put on a different lens in the city. We're looking at it from a vulnerability perspective, whether these are your elderly, whether these are the individuals with comorbidities, but also specifically in terms of the 20 million rand grant in aid that we just dispersed, focused specifically on humanitarian relief and also assisting shelter-based organizations that look after our homeless in the city, but also GBV shelters that look after GBV victims in our city as well. And so we are wanting to make sure that through this specific grant in aid, which is 20 million, but we've also recently, before that, made available 30 million. And I speak to many people across the city, and I ask which other city in this country has made money available, 50 million rand plus more to come, specifically for homeless communities or other vulnerable communities that may exist in various cities. And so this is going to help these organizations to either buy things to ensure sanitization at the facilities, your jik, your detergents, etc., gloves, etc., but also will help the organizations to feed the homeless people or the GBV victims victims in these facilities, but also will allow the organizations to continue doing their work. I recognize that with homelessness specifically, because it's a big issue in the city, that it's a number that's continuously growing, and COVID has made that worse. People not going to job, not getting income, and even during the lockdown, evictions taking place with very little enforcement or correction of that by the police services in the city at least. And so we'll see more and more homeless people, but the city is very proactive in making safe spaces available. We've opened up now 3 additional safe spaces in the city for our homeless communities. I'm excited because we're opening up another one tomorrow, where we're going to be welcoming just over 200 people in our new shelter. And this is what we need to do: look at individuals through a vulnerability lens, recognize the impact of COVID, close the gaps so that as many people are looked after and taken care of in the city through the means that we have available.
Also, I mean, I was talking to Dan, the mayor, on Friday last week. I mean, we're one of the only cities in the world that's actually got an outreach program trying to deal with people who are addicts and have alcohol addiction on the streets.
Yeah.
A lot of these people are there because they are hooked on drugs or have an alcohol problem. And there's an active outreach by the city's health departments and others to go out and screen and try and get these people into facilities.
The city is great for a number of reasons. We've got these matrix facilities that you've mentioned. We opened 2 last year, which I'm was very excited about and remain excited, because these are in communities where drugs and alcohol is rife. On every corner you'll see drugs and alcohol. So we've got now a free facility being our matrix centers, where residents are able to access supportive care and intervention programs. But on top of that, our 3 people unit that you mentioned, extremely active across the city. Which other city has a 3 people unit? We've got other cities visiting Cape Town to come and see what we do here so that they can try and implement. But these 3 people unit then connect homeless people, specifically homeless people, either to shelters for GBV or general shelters, but also take you into our rehabilitation spaces. We even help you with IDs, we help you with upskilling programs, and we help with employment in the hope of addressing homelessness more holistically and seeing an individual not simply as homeless but needing support to be able to exit the cycle of poverty and homelessness.
So, Siviwe, why has there been a rise in GBV during this COVID period? What underlies it? Why have we seen a sudden uptick in it again?
Look, I think South Africa remains a hugely violent society. I think once we start to see exacerbating factors such as people losing jobs, losing incomes, being at home for elongated periods of time, drugs, alcohol, I think those become, they compound the issue. But understanding that we intrinsically are violent. And we have seen over the years that the situation has become worse. But I think it's become highlighted particularly because people in many instances sometimes have had to live with their abusers 24/7 in their homes. And so during this time, I think it has been extremely difficult for people to seek the kind of help that they need. And so it's absolutely heartwarming to hear that, the city has interventions to particularly help and combat the issue around GBV, because I think that people who have had to be locked down at home without any other alternative shelter would have needed something like this.
So let's go back to you. Big question on Cape Townians' minds. Will the city be able to cope with the rising number of infections?
I believe so.
And why do you say that?
So as I mentioned earlier, we work very closely with our colleagues at Province. And so we've recognized what needs to be done in terms of access to facilities. We know in terms of local government, at least, primary healthcare is very important. And so on the one hand, we want to make sure that our clinics remain open to access either services related to COVID-19, but also more importantly, services related to chronic conditions. We're seeing a very worrying trend at the moment with a decrease of at least 67% in immunizations in our clinics. And that's extremely worrying, Siviwe. But also in addition to the fact that chronic medication is being picked up but not being taken as regularly as it should be. And so I say we're ready because the city has identified 80 additional clinic spaces, being community halls, etc., that we're converting into additional clinic rooms so that we can decant potential COVID patients from a clinic environment into a decant overflow facility so that we remove the risk, so that our nurses remain safe, so that they are able to come to work, but also so that our patients can remain safe. Beyond that, our environmental health practitioners play an immensely important role. When I became a MACO member, we had, there needs to be a certain ratio, and I inherited a ratio of about one environmental health practitioner to every 25,000 residents in the city. At the moment, we're well underway to reaching the 1 in 10,000 residents, because we've been active in employing more and more EHPs in the space to do a number of things, to educate our communities, to be a part of the intervention and prevention programs, but also to participate in the monitoring of the necessary regulations, whether it comes to old age homes or grocery stores or big supermarkets that need to make sure that when it comes to the preparation of food, hand sanitizing, mask wearing, and just making sure there's a plan, that there's a plan in place, because they're able to enforce that. But also our city health team is very active in the contact and tracing part of the whole.
The stuff Alex was talking about.
Exactly. So the minister previously would speak about the bushfires needing to be addressed, and I was so concerned where I saw this narrative in the country about the city and the province being the epicenter of the epicenter, and I said to Cockta as well that yes, we're going to be the epicenter of the epicenter,
but it'll move,
because we are looking for the cases proactively, unlike other provinces that didn't have a plan
and are now overwhelmed.
And are now overwhelmed. And the difference here is that we had a plan, they don't have a plan here. And so there's again the very important difference here.
So comorbidities linked very much to COVID and age.
Yeah.
So what is CICI doing about those people who need medication? Is there a plan in place for them?
Absolutely. And here again, we're working very close with what we're calling our community-based teams. The city has launched these teams across our communities in the city that have various stakeholders, sub-council managers, councillors, healthcare workers, that either will do one of two things: will deliver chronic medication to your door, or will arrange for that to be delivered by a number of other services, or will pre-arrange for these medications to be picked up at the facility in a safe way. I think again the city is unique because we've been able to implement an appointment system at our clinics, so that the waiting time for residents move from 5-7 hours, because you're queuing at 3 o'clock in the morning, to about 1 or 2 hours, depending on the backlog that may be at a clinic on that day. So we recognize that age and comorbidity are high risk factors here. Diabetes, the stats coming out now show that there's a close connection between diabetes and COVID-19, with 52 out of 100 people succumbing to COVID because of those comorbidities. And again, here is the province being very proactive, because besides just identifying diabetes as a real risk that needs proper intervention, where through province and the provincial health department, we're now actually phoning diabetic patients to make sure that they're taking their medication, that they're looking after themselves, that they don't exhibit any symptoms. We're now moving on to identifying obesity as the next issue that needs to be intervened on. So we've got all of this working in synergy with each other, because we're guided by experts and we have proper oversight politically and administratively. We're able to implement this advice from experts in a very efficient way.
Well, Zahid, it's been great to have you on, and it's so great to see your enthusiasm. And you know, Siviwe, I've said it so many times on the show before, that when the long view is taken of this COVID crisis and we look back and do the final analysis, this city and this province's response is going to be, I think, an example of what should be. And if only this had been done around the rest of the country.
Absolutely.
So thank you very much both for coming on, and I look forward to having you both back on the Straight Talk platform to be direct about some of these key issues that we've spoken about. And maybe we start unpacking, you know, about this violent society and what the triggers are, because I know you've got some views around what some of the underlying triggers are and the role that alcohol and drugs play in community violence and feeding. So there's so many conversations to have, and I look forward to having you both on Straight Talk. So thank you both for being here.
Thank you very much.
Great. Well, South Africa, there you have it. We promised you another action-packed episode and we delivered. Certainly much food for thought, and I'm very proud of our team led by Zahid in the city and our team led by Noma French and Bombo at the provincial level, and the incredible leadership shown by their two political principals. And of course, my good friend Siviwe Gwarube, who's been doing an excellent job. If you want Siviwe as the Minister of Health, make sure you vote for the DA in the next election so that we can get her in there. I think South Africa would be a healthier place. My shout out this week goes to Diane Kohler-Barnard. Excellent work done this week, Diane, on bringing the plight of farm attacks. We've also seen a huge jump in those numbers, and Diane's been out on the hustings every single day, bringing this issue to the attention of the authorities and putting on the table a really great plan about how we can improve rural safety and make those communities far safer. Well, we'll see you on Friday. Remember, it's the final episode of Coronacast, so do tune in. We've got some surprise guests and some exciting activities taking place on it. So we'll see you Friday at 2 p.m. Until then, stay safe, South Africa.